A hernia is a hole on the inside of your body where tissue bulges or sticks out through the hole. Incisional hernias form in the abdomen, which is the area between your chest and hips. Your intestines, also called the bowel, and other organs all sit inside your abdomen. They are held in by the abdominal wall, which is made of layers of muscle and tough tissue called fascia. Your organs are tightly packed in your abdomen, and they press against the abdominal wall. So if there is a weak spot in the wall, usually in the fascia, the lining, tissue, fat, or a loop of the intestine can poke through. And that's what causes the pain or bulge you may feel. Incisional hernias form after people have surgery on their abdomen. That's because during an operation, doctors often need to make an incision or cut in the abdominal wall. And after surgery, stitches are used to close the opening in the fascia. The stitches hold the fascia together so that scar tissue can form where the cut was made. It's the scar tissue, not the stitches, that holds the abdominal wall together. Now, some things cause problems with healing after surgery, and they can make the scar tissue weak. For example, if you get an infection in the wound, if you smoke, or if you have diabetes, your scar tissue may not form the way it should. But even if the scar tissue forms correctly, this area is never as strong as it was before surgery. And pressure from the organs in your abdomen can stretch the scar tissue and make the area even weaker. And other things may put even more pressure on it. Things like pregnancy, having a higher body mass index, BMI, which is a measure that relates to weight and height, lifting heavy objects, coughing a lot, or straining when you go to the bathroom. These can all put pressure on the scar tissue. Eventually, all this pressure can cause a hole to form. This can happen soon after surgery or even years later. But once there is a hole, a loop of the intestine can poke through, creating a bulge. And if you have a bulge, it may be visible all the time, only sometimes, or it may disappear when you lie down. A hernia repair can reduce or get rid of any pain or bulge you may have, and it stops a hernia from getting larger or more serious. Let me explain. Most hernias can be pushed back in from the outside. Your doctor may even try doing this as a test. This doesn't fix the hernia, but it means that for now, it's not dangerous. Unfortunately, over time, most hernias become larger and more painful. A hernia can get as big as a softball, and a larger hernia is more difficult to operate on. When a hernia is painful and cannot be pushed back in, it is called an incarcerated hernia. With an incarcerated hernia, the intestine or tissue that bulges out becomes trapped. And in some cases, the tissue can become strangulated, which is when the blood supply to the tissue is cut off. When this happens, it is called a strangulated hernia. This is often an extremely painful and life-threatening condition, and emergency surgery is needed. So even when a hernia is not painful, it may be repaired to keep it from becoming larger or to stop it from turning into a more serious condition. Now, a hernia can become incarcerated while you're waiting for surgery, but this doesn't happen a lot. That said, contact your doctor right away if you cannot easily push your hernia back in. But do not try to push it in if it is painful or swollen. And get emergency help if you also have pain or tenderness near the hernia that suddenly gets worse, any swelling in your abdomen, you feel sick to your stomach, or you are throwing up, or if the area around your hernia changes color and becomes red, purple, or much darker than your usual skin color. These may be signs that your hernia has become incarcerated. But otherwise, it is safe to wait until your scheduled surgery. And your hernia can be repaired before a serious problem develops. At this point, do you want to make any notes? Okay, let's move on. There are a few important things to go over with your doctor before your surgery. First, let your doctor know if you have any health conditions or allergies, especially if you or anyone in your family has ever had an allergic reaction to anesthesia. Let your doctor know if there's a chance you are pregnant. If you have had past surgeries on your abdomen, like if you've had a C-section or had your gallbladder removed, or if you have ever had a hernia repaired before and if mesh was used to repair it. Also, for your safety, make a list of all the prescription medicines, over-the-counter medicines, vitamins, herbal supplements, and recreational drugs you take. It is important that your doctor knows all the medicines you are currently taking because it may impact how you prepare for this procedure. And let them know if you take blood-thinning medicine. Your doctor may have special instructions for this before the procedure. If you smoke, make sure your doctor knows this. This is important because smoking can cause serious problems with healing. So your doctor will probably ask you to stop before and after the procedure. Okay, now let's talk about planning for surgery. You may have trouble going upstairs for the first few days after surgery. So if you have stairs, it's a good idea to set up a recovery area in a place where you don't have to climb stairs. Also, find out when you need to stop eating or drinking before your procedure. This is important because if there's anything in your stomach and you throw up during the procedure, it can be very dangerous. If you don't follow your doctor's instructions for this, your procedure may have to be rescheduled. If you take medicines, on the morning of the procedure, your doctor may ask you to take some or all of them with just a sip of water. Finally, on the day of your procedure, someone from your care team will trim the area around your hernia. So do not shave, wax, or trim this area yourself beforehand because that can lead to infections. Your doctor will have a specific plan for your procedure, but I'll give you a sense of how it will go. Before the procedure begins, the spot where your hernia is will be marked, and someone from your care team will check with you to make sure that it is the correct side. This is an important and standard safety check. Next, an IV line will be placed in your hand or arm for medicine and fluids, and you will likely get antibiotics through your IV to reduce the chance of infection. Then you may get some medicine to help you relax. This surgery can be done using different levels and types of anesthesia to make you comfortable. For example, your doctor may numb a small area around your hernia, numb the whole side of your abdomen or belly area, or they may numb everything from your waist down during the procedure. With these types of anesthesia, you will likely get sedation as well. This is a medicine that can help you feel relaxed and calm. But most of the time, general anesthesia is used, which puts you into a deep sleep. The level and type of anesthesia and sedation you have will depend on the size of your hernia, how the procedure is done, and your doctor's recommendations. Your doctor and anesthesiologist will go over your options and what to expect before your surgery. When everything is ready, surgery can begin. There are a few ways to do this surgery. In open repair surgery, your doctor may make a single opening over the hernia to do the repair. In laparoscopic repair surgery, they may make a few smaller openings and use a tool called a laparoscope to do the repair. And in robot-assisted repair surgery, they may perform the surgery with the help of a robot. Your doctor will choose the approach based on their professional experience, the size and location of your hernia, and your specific health needs. Okay, here is how each approach is done. If you have an open repair surgery, your doctor will first make an opening over your hernia. They will locate your hernia and gently push the tissue back into your belly, abdomen. Or sometimes they will remove the bulging tissue instead. Then your doctor may close the inner layer of the hole with stitches and place a material called mesh to reinforce the hernia repair. Once placed, the mesh is attached to the abdominal wall using stitches, staples, surgical tacks, or glue. After surgery, you will not be able to feel the mesh. It will stay in your body, and over time, strong, thick tissue in your body will grow in and around it. The mesh helps strengthen the abdominal wall and keep the hernia from coming back. Finally, your doctor will close the opening in your abdomen with stitches, staples, clips, or glue. Okay, laparoscopic or robot-assisted repair approaches are very similar to each other. The difference between these is how the tools are moved during the procedure. If you have a laparoscopic repair, your doctor will move the tools by hand. And if you have a robot-assisted repair, your doctor will use a special robot to move the tools. With either approach, your doctor will first make a small opening near your belly button. Then your abdomen will be filled with a gas to create space, so it's easier for your doctor to operate. A slim telescope-like tube called a laparoscope is then placed through the small opening. The laparoscope is attached to a video camera so your doctor can see the inside of your abdomen on a TV screen. Then a few more openings are made nearby so they can insert other tools. Once the tools locate the hernia, they are used to gently pull the tissue back into your abdomen. Or sometimes they are used to remove the bulging tissue. Then your doctor will likely close the hole with stitches and place mesh either behind or in front of your abdominal muscles to reinforce the closure. Then the mesh is attached to the abdominal wall using stitches, staples, surgical tacks, or glue. Finally, your doctor will remove the tools and close the openings made in your abdomen using dissolvable stitches, staples, clips, or glue. And a tube may be placed to drain fluid from your abdomen. This will be removed sometime in the first week or so after surgery. Then bandages are used to cover any openings in your abdomen. A large piece of stretchy material called an abdominal binder may also be used. Your doctor may ask you to wear this for a month or two after surgery to help your muscles heal.
At this point, do you want to make any notes?
Okay, let's move on. After surgery, you may feel groggy and a little fuzzy, and you may feel a little sick to your stomach or have the chills. You may also be hooked up to some monitors and your IV line for medicine and fluids. During this time, your care team will monitor you and help you feel comfortable. Once your doctor thinks you are ready, you can go home. The timing can vary, so ask your doctor when you can expect to leave after your procedure. And when it is time for you to leave, make sure you have a ride home. It is not safe to drive after you've had anesthesia. Also, you may not be allowed to take a cab, bus, or ride share alone. Now, for the first few days after the procedure, you may have some pain or bruising in the area where surgery was done. And if you have to walk or climb stairs, you may feel sore. Your doctor may recommend that you take over-the-counter or prescription pain medicine to help with this. Just make sure you understand their instructions on how and when to take it. And you may want to hold a pillow against the area when you cough or sit up. This can really help with any pain. If your surgery is done with a laparoscope, you may have some pain in your shoulder or back for a few days. This is from the gas that was used in your abdomen. And in the weeks after surgery, you may have some swelling in the area where surgery was done. It may feel like a lump under your skin, or it may even feel like your hernia has come back. But this is not another hernia. The swelling is caused by fluid that often builds up near the repaired hernia. And over time, the fluid usually goes away on its own. If it doesn't go away, your doctor may drain it. Sometimes a hard ridge may form near where your hernia was. It may feel like a roll of quarters under your skin. But again, this is not a hernia. It is a normal part of healing and called a healing ridge. A healing ridge can happen as tissue grows in and around the mesh that was placed, and it will flatten out in a few months as it heals. Okay, your doctor will likely give you some general instructions for caring for yourself after surgery, and it is important to follow all their instructions. For example, they may ask you to take a stool softener for a little while so you don't strain when you have a bowel movement or poop. They may also give you instructions about when you can drive, bathe, or lift heavy objects after surgery. And they may go over when you can expect to return to work or do other activities after surgery. Everyone is different, so be sure to follow your doctor's specific instructions for you. If you don't, you could injure yourself or delay your healing process. After surgery, there is also a chance your hernia may come back. So your doctor will likely go over some things you can do to help prevent this from happening. It is important to follow their instructions for this, too. Finally, if you have any problems as you recover, please contact your doctor. Contact them right away if you have a fever or chills, sudden shortness of breath or chest pain, a cough that won't go away, or you cough up blood, you're sick to your stomach, or you throw up a lot, if it's difficult or painful to urinate or pee, or if you feel lightheaded. Now, it is normal to have some pain and swelling around your wound, but if your pain or swelling doesn't go away or suddenly becomes a lot worse, contact your doctor. And contact them if the area around your wound starts looking like you have a sunburn. There is a lot of blood or fluid soaking through your bandage. There is pus coming from your wound. Or if you have pain or swelling in one or both of your legs. If you experience anything unusual, or if something just feels wrong, let your doctor know. You know your body best. One benefit of hernia repair is less pain, and you'll no longer have a bulge if you have one. Your hernia won't get larger and more painful, and you won't risk needing emergency surgery for an incarcerated or strangulated hernia. But like any surgery, a hernia repair has some risks. Understanding what is involved is an important part of surgery. We will go over 11 risks here, but there are some very unusual risks that will not be covered. So please do not consider this list complete. There is a risk that the hernia will return.
Would you like some more information about this risk?
A hernia can return months or years after the operation. If this happens, more surgery would be needed to repair it again. If a hernia does come back, it can be more serious and harder to treat. And once a hernia is repaired a second time, it's much more likely to keep coming back. So to help prevent a hernia from returning, follow your doctor's instructions about when it's safe to return to work and other activities after surgery. Also, many things can play a role in a hernia returning, like the size of the hernia, your age, and your overall health. And if you smoke or have a higher body mass index, BMI, the chances of your hernia returning are higher. So if you are worried about any of these things, ask your doctor what steps you can take to lower your risk. There is a risk of infection. Although your doctor will take great care to prevent infections, an infection can still develop in the surgical area or in other organs, like your bladder. If mesh is used to repair the hernia, the mesh can also become infected. Most of the time, antibiotics get rid of infections, but sometimes more treatment is needed. In some cases, surgery may be needed to remove and replace the mesh. There is a risk of bleeding both during and after the surgery. It is common to have some bleeding during the procedure, but there's a chance you may lose more blood than expected. Usually, doctors can control any bleeding during the procedure. Rarely, a blood transfusion is needed. Although banked blood is checked for diseases like HIV/AIDS or hepatitis to make sure it's as safe as possible, there is still an extremely small chance you could get a virus or your body could reject the blood. And while it's rare, you may have bleeding on the inside of your body in the days after surgery. If this happens, you may need another operation. There is a risk that nerves and tissue in the area your surgery is done can be injured. For weeks or months after surgery, you may have numbness, tingling, or new pain in the area the hernia was repaired. Most of the time, these problems go away on their own. But in rare cases, the pain or numbness does not go away. This can happen when the stitches, tacks, or mesh used during surgery injured tissues or nerves in the abdomen. Surgery may be needed to remove these materials and repair the injury. And while it's very rare, the pain may still not go away, and you may need to take daily medicine for it. There is a risk of injury to the organs near your hernia. Because some organs are near the area your doctor will operate, they can be injured. These may include the intestines, stomach, liver, bladder, the tubes that carry urine to the bladder, called the ureters, and blood vessels. And if you have a uterus or ovaries, these can also be injured. If an organ is injured, it's usually repaired during surgery. But if your intestines are injured, the hernia repair may be stopped, and another operation may be needed to finish the repair. In rare cases, the injury may cause permanent problems. There's a risk of bad or allergic reactions to the anesthesia, medicines, or materials that are used. Some people may have bad reactions to anesthesia. For example, they may feel sick to their stomach or throw up after their procedure. But an allergic reaction happens when your body tries to get rid of something it doesn't want, and it's your body's response that can be serious. Your healthcare team is trained and ready to respond to allergic reactions, but in rare cases, people can die. If you have ever had an allergic reaction or know you are allergic to any drugs, foods, or materials like latex, please let your doctors know. And let them know if you or anyone in your family has ever had a serious reaction to anesthesia. There's a small risk of breathing problems, including lung infections like pneumonia. During surgery, pressure can be put on your lungs. This can happen when the hernia is pushed back in. It can also happen during laparoscopic surgery when your abdomen is filled with gas. This pressure may cause shortness of breath or difficulty exercising. Most of the time, these problems go away soon after surgery. While it's rare, they may continue for days or weeks. If pressure is placed on your lungs, there is a risk of developing lung infections like pneumonia after surgery. If this happens, antibiotics or other treatment may be needed. If your operation is done with a laparoscope, during surgery, it may change to an open procedure. While it's rare, there are times during laparoscopic surgery when a doctor needs to switch to an open procedure. Although the outcome is similar, with an open procedure, a larger opening is made in the abdomen. This could happen for many reasons, like if there is a lot of bleeding or if there is scar tissue that makes it difficult to operate. Your doctor will only make the switch if it's needed for your safety. If an open procedure is done, your recovery may be longer. In the days after surgery, there's a risk your intestines may become backed up. After your stomach breaks food down, it moves into your intestines. But after this operation, it can take a little while for your digestive system to wake up. So your intestines may not move the broken down food along and out of your body like they should, and your intestines can get backed up. This backup is called an ileus, and it can cause the area below the belly to become swollen and very painful, and people may get a fever or throw up. To treat this, all food is stopped for a while and fluids are given through an IV line. If this doesn't work, a small tube may be placed into the stomach or intestine to treat the backup. To help prevent a backup, you may be given ice chips and then clear liquids for a day or so after surgery. You'll start eating again once you pass gas and your doctor hears your intestines making noise. That's a sign they're working. There is a risk of blood clots that in rare cases can be life-threatening. Blood clots can form in your veins during or after surgery, and in rare cases, a blood clot can travel to the heart or lungs. This can be very dangerous and can even be life-threatening. There is an extremely small risk of a stroke, heart attack, or death. Although the risk of a stroke, heart attack, or death is extremely small, these and other risks are possible during your surgery or recovery. Things like your age, the condition of your heart, your body mass index, BMI, and past illnesses and surgeries can make surgery more difficult. As a result, you could become seriously ill or die.
At this point, do you want to make any notes?
Okay, let's move on. If a hernia isn't large or painful, some people choose not to have surgery. But over time, a hernia may become larger, more painful, and more difficult to treat. And if your hernia becomes incarcerated or strangulated, you may need emergency surgery. So, to avoid these kinds of problems, getting your hernia repaired now may be the best option. That said, it's possible that your doctor will want to wait a few months before doing surgery. This is because if you smoke or you have a higher BMI, your hernia is more likely to come back. And if your doctor thinks it's safe to wait, they may want to give you some time to lose weight or quit smoking. That way your hernia is much less likely to return. But even if you wait to have surgery, your hernia will not go away on its own. Surgery is the only way to repair a hernia. So talk to your doctor about your options. Together, you can decide what is right for you.